When dealing with peripherally inserted central catheter, it is very important to perform proper hand hygiene to prevent central line associated bloodstream infection. Before touching the patient, it's also very important to don a clean gloves. Introduce yourself to the patient. Identify the patient using two valid patient identifiers such as name and hospital number. Explain the procedure to the patient and obtain verbal consent. Assess the insertion site for any signs of infection such as redness or inflammation. Check also for the external length of the catheter. PICC line dressing, specifically transparent dressing, should be changed every 7 days or as needed. When removing the dressing, remove the dressing one at a time. When removing the main dressing, you may loosen the edges first. Remove the dressing starting from the hub towards the insertion site. You may apply different techniques such as stretching on the transparent part or rolling towards the insertion site. Remove the stabilizing device by loosening the adhesive part. If it is difficult to remove or if it becomes too sticky, you can use alcohol to help loosen the adhesive. Lift the bottom part of the clip one at a time. Remove the catheter flange slowly from the securement device and stabilize it on one side. Carefully remove the securement device. Remember, do not touch the catheter insertion site. If the skin around the insertion site is dirty, it is recommended to clean it first. Disinfect the trolley using a surface disinfectant following manufacturer's recommendation. Establish a sterile field and prevent it from contamination. Slowly drop sterile items in the field. Avoid loosening of wrappers of items on top of the sterile field. Items that will be needed includes the following: saline flashes, chlorhexidine sticks, extension tubings if needed, stabilizing device, sterile gauze if needed, Tegaderm dressing with chlorhexidine. If a lumen will not be used, we can close the hub with a sterile cup. Remove clean gloves and perform hand hygiene. Don a sterile gloves. Place a sterile drapes under the patient's arm. To do this, you will need to ask the patient to raise his arm, or you can ask help from another nurse. The assisting nurse can also provide stabilization to the catheter to prevent catheter malposition. Cleanse the exit site using chlorhexidine swab or sponge or suitable solution using back and forth motion for a minimum of 30 seconds and allow the site to dry. Secure the catheter in place with a sutureless stabilizing device according to manufacturer's instruction. In this procedure, we're using a stat lock. Statlock comes with a skin protectant that provides a barrier between the adhesive and the skin. This would prevent adhesive-related skin injury. We need to apply the skin protectant on the surface of the skin where the adhesive will be attached. Apply sterile, transparent, chlorhexidine-impregnated dressing or appropriate dressing. Ensure that the chlorhexidine gel covers the insertion site. When using Tegaderm dressing, do not stretch the dressing. When applying dressing for PICC line, if it is possible, ensure that the stat lock is also inside the dressing. Ensure that all edges of the dressing are properly sealed. Label the dressing with date, time, and initial, or as per organizational practice. This is important so that the next nurse would know when to change the dressing. After the procedure, discard used supplies, including personal protective equipment, and perform hand hygiene. Document also the procedure in the patient file. This procedure is about flushing and locking of a central line. In this scenario, it involves flushing and locking during initiation of an IV line. This occurs in an inpatient setting, in a newly admitted patient where there is a need to initiate an IV line, or patients who have weekly flushes. Prepare your materials. For this procedure, you'll need plenty of alcohol swabs, normal saline flashes, and Y connectors. Perform hand hygiene and don a clean gloves. When using the PICC line for a prolonged period of time, it is advisable to use needleless connector. In this case, we're using Y connector tubings. When using a connector tubings, ensure that the line is primed. Ensure to clamp each tubing after priming and loosen the cap that covers the tubing. Since we're going to access 2 lumens, we're going to prepare 2 sets of Y connectors. When dealing with PICC line, we use pre-filled normal saline flashes. But if this is not available, we can prepare it from 10 ml ampules. It is also important to note that when we are dealing with PICC line, we use a syringe which is 10 ml or bigger because the pressure that it creates during flushing is lesser. Remember, the bigger the syringe, the lesser the pressure. Remember, all odds-on, including Y connector tubing, should be changed every 72 hours or as needed. If the Y connector tubing is already dirty, even if it is less than 72 hours, it needs to be changed to prevent central line associated bloodstream infection. We need to disinfect the half of the lumen with an alcohol swab before and after every access for at least 15 seconds. After disinfection, let it dry and connect the Y connector tubings. Open the clamp and gently aspirate until a blood return is visible in the tubing. This is the blood return. We need to ensure that there is blood return before pushing anything to the PICC line. Flash the catheter and assess port patency and function. The technique of flashing is push-pause technique or pulsatile flushing. The volume of our flash is 20 ml normal saline for each lumen. Remember to clamp while pushing for the last syringe to create a positive pressure. Disinfect the needleless connector after using with alcohol swab for at least 15 seconds. Now, we repeat the procedure with the other lumen. When doing your flushing, the position of your syringe is a little bit upright. This will help bubble to settle on top of the syringe. We cover our needleless connector with a sterile cup with sponge and alcohol to provide disinfection. Now, your PICC line is ready to use.